such a good pin drop silence here. Really appreciate it. Either you have slept or you are very alert. Puducherry is known as a spiritual and a French heritage destination. And the motto is, have a break in life, relax the serene atmosphere. It is a conclave of erstwhile French territories in different states. We have got 4 regions in 3 different states. One is in Puducherry headquarters, then another one is Karnataka in Tamil Nadu, a small 50,000 population in Jam, another small 50,000 population in Kerala in Mali. So the administration is a bit difficult, but we are doing it. Because the languages, cultures are different in these 4 regions. The French also has left a different legacy. They made healthcare a prime thing and put in place a very good healthcare system. So much so the neighboring states still come to French. They say, let us go to French whenever there is any problem. And Jipmer being there in Puducherry has attracted a lot of people from Tamil Nadu. 95% of the attendance is from Tamil Nadu, only 5% from Puducherry. Puducherry is having 30 lakh population in 4 different regions, and it has a huge network. We have got 8 major hospitals, 4 PHCs, 41 PHCs, 81 subcentres, 7 private medical colleges, 1 government medical college, 1 college of national importance in Japan. So it is what's called overloaded with healthcare. So much so, Government of India always looks forward for Puducherry to implement the newer initiatives. And the government, Puducherry government has taken over from the French, and they have the French initiative, and still we are continuing to give free medicine delivery. That is free consultations, free diagnostics, whatever it is. It's just patients just walk in, you get consultation, you get free diagnostic. Even MRI scan, CT scan is free. And free surgery, whatever the surgery is. Even cardiac surgery is free for all the patients in Puducherry. So this, because its legacy, maybe we have achieved a lot in disease. And we also, the present government is pumping in money as French system. That is 2.5 of the GDP of Puducherry goes into healthcare, which is considered a very good WHO. And 8 to 10% of the planned budget goes to health department. So much so we have achieved some good health indicators. The infant mortality rate is 11 now, from last 5 years, 22 has come down to 11. MMR is 86, which includes Jipmer mortality rate also. If we exclude Chennai and consider only Puducherry MMR, Puducherry residents, it comes down to 25 per 1 lakh. Still birth rate is 1.3, low birth weight is just 1.5. Total fertility rate is 1.6, where the Indian average is 2.4, and under 5 mortality is 4.4. Let me take you to the newer initiatives now. Though we have got such a good network, still people look to Chennai for many of the tertiary. To decrease this, what we have brought out, a PPP model on cardiac surgery. It's unique. We have got the Frontier Lifeline, Dr. K.M. Cherry, who all of you heard, the wonderful person who started cardiac surgery in India. He is having a MOU with us, and their team come every 2 weeks and do the surgeries. And we are paying in CGHS rate, that's just 1.31 lakhs per surgery. Of that, 1/3 is given back by Frontier Lifeline to the general hospital for the usage of the infrastructure. So hardly 84,000 rupees per surgery for Frontier Lifeline, and I think it is perhaps the most economical cardiac surgery. And it's still not bad surgery. Surgery is so good. After the 100+ surgeries done over 1 year, there is only 1 mortality. And it's supposed to be international standards. And add to this, we have screening all the newborns for cardiac defects. And those cases, the cardiac defects are selected for doing cardiac surgery. So this is one model. The next one is we all think of diseases, we want to start thinking of how to prevent diseases. So as an initiative, we start the Lifestyle Modification Center as part of National Ayush Initiative and NCT program, both together combined. This is a wellness program for healthy and fulfilling life. We have got an old heritage building we are using as a center where we do screening and counseling for lifestyle diseases, yoga and movement hall to integrate body and mind. That is, wherever we find, we do screening for BP and diabetes, and wherever we find positive for them, we advise with the counseling and send them to yoga and movement hall to learn yoga and to learn meditation. Relaxation and rejuvenation in acupuncture, Reiki and Tai Chi dancing are also included in this. These two parts have been already started, screening and yoga. Next two things which are in the future are health food restaurant. That is, we have got Ayurvedic thalis, organic products, cooking classes, dieting advice. We use concepts like how to have multigrain or complex carbohydrates to be taken by the patients in their diet. You have an example of black idlis and red dosas and green dosas in this hotel which you are planning. So they have a multigrain, unhusked black gram is used for idlis, so that they have black idli but still very rich in fiber and very good for diabetes. So this and at the end of a meal, each patient will get not only bill, he will also get calories which he has taken, how much calories is consumed and how many steps he has to walk or what means of exercise to consume those calories which he has taken. This is the idea and which will be perhaps done this year. And next is multitasking auditorium where we have the lifestyle modifications. Within the lifestyle modification, we project all the health awareness programs. Because this particular lifestyle building is in the heart of the city, in the tourist area, next to the beach road. This particular center is used as a life modification center, and the concept, the building is there, and the restaurant and the yoga is already in place. The auditorium will be done next year. Next is all of us are talking about covering the patient above 30 years for the lifestyle disease. Actually, we started years ago. Now, this again is done in a PPP model with a company which works in that. There is Novo Nordisk, and they have got a Novo Nordisk Education Foundation. In this, all the people aged 30 years and above will be screened for diabetes, hypertension from the nearest government facility. We have these camps on every Tuesday and Friday for all the diabetes and hypertension clinics. Screening card is issued to them, and once a patient is found positive, he will be given a treatment card which will include the assessment of all the complications like retinopathy. All those will be included. Those checkups also, the food care, and all those will be checked. And even thyroid will be checked along with it. So this card is used by the patients to have their monthly treatment. Each patient is eligible to get the anti-diabetes. All the drugs are available, and even insulin is made available for all the patients who are born positive. And we find, in our experience, at least 10% of the patients require insulin. So a diabetic registry is made and maintained. Medicine is issued on basis of sometimes with the help of a specialist. The doctors in private centers were trained by this Novo Nordisk initiative. More than 500 health workers and doctors were trained, and some key trainers were trained under Chennai University. And each health worker in the PHC is given a role. The health worker, the LHV, the staff nurse, the driver, everybody knows their roles. So much so, we have covered about 60% of the population above 30 years. So ours is about 13 lakhs and 66.5 is the expected population to be covered. We have already covered 3.9 lakhs, and we find 38,000 to be positive for diabetes. That is 10% of the, more than 10 to 12% of the people are diabetic above 30 years. This works out to around 6% of the all the population, and about 14% are hypertensive. So this is a very good epidemiological data which we are having now, which can be extrapolated to the whole of the country. Though South India may be the capital of diabetes, maybe more. The next scheme which we have is the insurance scheme, or what Karnataka projected as an assurance scheme. This Puducherry Medical Relief Society is an assurance scheme. We do not involve an insurance company. We have our own team. We provide a maximum grant of 2.5 lakhs, which is much more than any company, for each individual, not a family. Each individual for 1 year he can take cover up to 2.5 lakhs, and the person eligible is not just 24 lakhs, 24,000 per year or 72,000. Now it's 1.5 lakh is the income below which they are eligible. So that assures more than 50% people come under this, and it's a good initiative on the part of the government. And at times, wherever advances per 75% also can be given as advance. So all this, we are empaneled hospitals around, in and around Puducherry, and we pay and CGHS packages. And most of the hospitals are ready to do MOUs. And it is again just like an insurance scheme. It is a cashless based scheme. Wherever the a person approaches a empaneled hospital, he can just register himself, and the money, the payment is made to the hospital directly by the government. How it is different from insurance scheme? The insurance scheme, the person walks directly to any hospitals and claims himself as the patient and gets treatment where they can be policies. But here, what we do is we ask the patient to come to a general government hospital institution, and if that particular procedure is not done in the government hospital, only then is referred to the empanelment. So that he has to get a UOC to do that, unless it's emergency. So with this scheme, we have spent about 3.7 crores in 14-15, 7.89 15-17, and 3.5 up to January in 16-17. And beneficiaries are always about more than 300 each year. The next scheme, which is an insurance scheme, why we opted for insurance scheme in this particular case is, this is a pensioner scheme for all the government servants. The government servants actually are the people who are 60 plus, and they are the people who are liable to major diseases, and most of the insurance schemes which the government reimburses are below 60. So this scheme is unique in that case the parents, especially in Puducherry, have children everywhere, and the education is so good, they are well placed on metros, and these parents move to the metros or visit the children in the metros, sometimes abroad, but this is for India coverage only in India. So anywhere in India, they are eligible for the coverage, though they are covered only in Puducherry. If they are traveling, they are still eligible. And more than 6,000 hospitals across India will be empaneled. And this, somebody will be very proud today. I tell you that New India Insurance Company is our partner in this. And Madam, I'm very happy today. So this initiative will assure these patients of any disease coverage up to 3.5 lakh on quota basis, not only to the patient, to his spouse also, for 1 year. So, and what will be done is the patient the pension need not pay anything from his pocket. Each medical pensioner is eligible under the Commission of Precaution up to 500 rupees medical allowances every month. So of that, he pays only 300 rupees towards the medical allowance, towards this insurance scheme. So 3,600 plus tax for the premium, and he gets a coverage of 3.5, sometimes 50,000 extra if it is necessary, and is anywhere in India, and it will be covered for the spouse also, and after the death of the insurer also it is covered for the spouse. So it's the New India Insurance Company are very proud of this scheme, and we do hope it will come out very successful. So on behalf of Puducherry and me, being a Bangalorean, he graduated from Bangalore Medical College. I cannot forget Kempegoda, who brought his Bangalore to us. So on the foundation day, I give my homage and my praises to Sri Kempegoda, Sir Prabhu Sri Kempegoda. So thank you all for patience. Thank you.